We are expecting our guests to join a video link anytime soon. Dr. Tuyi Mebawondu will be talking about the malaria vaccine, what it means for the fight against malaria, and of course, we'll be taking your thoughts as well if you also agree or are happy with the introduction of that vaccine. Some speculation as to whether this malaria vaccine is fit for human consumption, whether there's some sort of a ploy, conspiracy to wipe out the black race, Africans, and all that. So we want to look at all that this morning on the Morning Crossfire, and basically what it means for the eradication of malaria. Do you welcome a malaria vaccine? Do you feel that's something that is good? And will you be taking the malaria vaccine? I want you to call right now, 0700-993-993-993, 0700-993-993-993. That's the number to call. Our female line is 0201 465 7190. That's 0201 465 7190. That's a number for our female listeners. If you want to call, please call that number, 0201 465 7190. And on WhatsApp, you can send a WhatsApp message, short one, please, to the WhatsApp number 08095975805, 08095975805. Very important, 08095975805. You can also call that WhatsApp number, all right, using the WhatsApp mobile app, or you can send a short voice note of 1 minute or less.
What is health? It's more than the absence of illness. It's a state of complete physical, mental, and social well-being. But let's delve deeper. Health is the heartbeat of life. It's the rhythm that keeps us moving forward. The pulse that echoes our vitality. It's a symphony of balance and harmony, resonating in every aspect of our existence. Health is a silent conductor, orchestrating the dance between the body and mind. It's the energy that propels us towards our dreams and aspirations. It is the foundation upon which we build our futures. So, what is health to you? Join me, Kofi Bartels, this and every Thursday for Health Thursday, 8 a.m. on the Morning Crossfire as we explore important issues affecting your health. Only on 99.3 Nigeria Info.
Live from the heart of Victoria Island, you're listening to your number one station, 99.3 Nigeria Info. Morning Crossfire on 99.3 Nigeria Info.
Okay, so are you ready for this malaria vaccine? Will you be taking? Unfortunately, Dr. Tuyi Mebawondu has been become a victim of the ongoing construction around the Falmo axis, and which has affected the entire, Victoria Island, going to Ikoyi and all the parts of Tebe. I mean, everywhere is tight, and we can understand that the guest is he's unfortunately stuck there. He was on his way to the studio. I know that it's always a pleasure to have Dr. Mebawondu with us. All right, I'm seeing anyway. So will you be taking this vaccine? It's what I want to hear from you. Now, will 2024 be the year that Africa as a continent takes a significant leap towards beating malaria? Finally, or like we say in Nigeria, finally, yeah? We have two revolutionary malaria vaccines, the RTSS. We have the R21/Matrix. These are being rolled out across the continent. Will this mean that Africa finally defeats this thing called malaria? Yeah? Now, the RTSS, it was developed by Walter Reed Army Research Institute after 30 years of intense research, and it was approved by the World Health Organization in 2021. How about the R21 Matrix? Now, it's a second generation of RTSS vaccine, and it was developed by Oxford University's Jenner Institute and approved by the WHO in October 2021. 2023. In October 2023. So this is second malaria vaccine. It was approved just 2 years after the first malaria vaccine. So we have two. All right. Now, on the 25th of April, 3 West African countries, namely Liberia, Sierra Leone, and Benin, just next door to Nigeria, they rolled out, in thousands, by the way, doses of anti-malaria vaccines for infants between the ages of 5 and 17 months. Infants between the ages of 5 and 17 months. So these are African countries, West Africa to be precise, Liberia, Sierra Leone, and Benin. Now, the rollout began 5 months after, the WHO endorsed those 2 anti-malaria vaccines. So you have the RTSS, RT21, and this is what we have. But Nigeria, where malaria is responsible for 11% of maternal deaths, 11% of maternal deaths, 25% of deaths among infants. Despite carrying the highest global burden of the disease, Nigeria has yet to receive or commence administration of this vaccine. Is it time for Nigeria to quickly get on board this moving train? And are you ready for the vaccine? Dr. Mebawondu, are you there? Can you hear me, please?
Yes. Good morning, Kofi. I can hear you. Can you hear me?
Yes, we can hear you. We can hear you. I do not know which of you. Are you? Okay, I think this is okay. Okay, Dr. Melwood, you're welcome. We've seen someone else here, that's why. Sorry about the traffic. Please.
It's okay. It was the health activity, the health activity you were saying initially. I was trying to join on a bigger distance. I can hear you very well now.
Oh, okay. Would you prefer to join on that health, Nika?
Well, that would be the preference, but I don't want to miss anything about this discussion. It's so important.
Okay, because we can.
Let's continue our discussion. If I get through here, no problem.
Okay.
Let's continue our discussion.
We'll try to admit you on health, Nika. I'm seeing 2. So maybe we admit the second one, and then see if you can. Yeah.
You can cut off the health, Nika. Let's have discussion here.
Okay. All right. So while waiting for the calls come through, Dr. Tuyi Mebawondu, tell us about these new malaria vaccines. We've heard about the 2 of them, the RTSS and the RT21 malaria vaccine.
Yes, thank you so much. You know that the work to get a vaccine for malaria has been on for some time. Not until about 3 years ago, when we had a breakthrough and had to do a test. The pilot studies in countries like Ghana, Kenya, and in Ghana, Kenya, and Malawi, Ghana, Kenya, and Malawi, where 2 million children were vaccinated, and we saw the great effect of that vaccination and the report. So now, last year, it was approved by WHO that a framework for the rolling out of the malaria vaccines in about 12 African countries, the framework was approved, and about 18 million doses of those malaria vaccines were actually approved then. 18 million of those malaria vaccines were actually approved around that country. So, of course, the countries, some of the countries that got that approval, Benin, Burkina Faso, Burundi, DR Congo, Liberia, Nigeria, Sierra Leone, and Uganda. Unfortunately, yours truly, Nigeria, has not been enlisted because of some challenges with the framework and approval from our own ministry here. So that's the way it is. We've seen that successfully we have included the vaccines into some of those instruments we're using to fight malaria, because malaria, as we all know, causes as much as 600,000 plus deaths yearly, and infects more than 250 million people. Nigeria is a big elephant here because, most of the malaria here we get, Nigeria is leading, DR Congo is following.
Yeah, Dr. Mebawondu, are you there, please?
That actually are leading in malaria problem in Africa. So we hope that by the time this thing is rolled out, we then have another weapon to fight malaria. Of course, insecticide treated net, outdoor residual spraying, proper treatment. These are actually what we have.
All right.
We have fighting it. We're able to combat malaria.
Okay, interesting. Dr. Mebawondu, why isn't Nigeria on this list of countries you mentioned? Is there a reason?
There are paperwork that ought to be done at the level of the ministry, which Nigeria has not done. We hope they're going to do it now. That's just the basic things. Some of those delay that we just get involved in. So that's key. So you need to do those paperwork and so that you can be included. We've not done it. I'm sure we're going to write the letter. I'll focus on that soonest.
All right. I'm sure you're very aware that. But before you go there, how potent are these vaccines? How are they meant to work? So, because we hear of infants between 5 and 17 months, is that these infants are the only one who can take the vaccine? Can adults be vaccinated? Will it be that you just take a dose and that's it? How does it work? Is it a regular vaccine that we're used to?
Yeah, indeed. You target the people that are really exposed, that are at the highest risk of picking malaria. Who are these people? Of course, infants, pregnant women. We look at pregnant women, we're not going to administer the vaccines for pregnant women, but again, for these children, because most of the deaths from malaria come from them. Okay? The 600,000 plus, because if you look at it, under 5, every minute 1 under 5 dies of malaria. 1 under 5 dies of malaria every minute. And it becomes important for us to target that group and give 2 doses of those vaccines to prevent the severe form of malaria. Because the severe form of malaria will not only, kill, it can also damage brain, damage organ, and input into that child such a lifelong disability. So the target is the severe form of malaria and the age group being affected mainly. That is where we are.
All right. Interesting. You were, Dr. Mebawondu, of beliefs and our position, from African communities regarding vaccines. Some people don't believe in them. Even the polio vaccine has had its own difficulties with health workers being attacked, being chased, being beaten. Because it has social, religious, and cultural ramifications. So, what do you have to say about that in relation to this newly introduced malaria vaccine?
Kofi, let me tell you, vaccine hesitancy, vaccines refusal, and actually trying to people to escape being vaccinated is as old as vaccine itself. It's not a new thing, okay? Because if you remember, smallpox was killed as much as 500 million people for that number of years until sometimes in 1796.
Okay.
When Edward Jenner, that English doctor, developed the vaccine against smallpox. And then when the vaccine was developed, there were lots of backlash and pushback to reject the vaccination. So if you are seeing vaccine hesitancy, refusal is not new. Okay? But what is new is that why should we have that kind of level of refusal in this part of the world that is going to benefit from the vaccine? Now, at the core of vaccine refusal is an issue of trust. Because then, you remember, people didn't really quite trust the government. They are saying that, how can you bring to us vaccines that we don't know how it's going to work? We don't know the effect on us. You have been tasking us. Why are you suddenly showing love to us now? So that is key. And some people are saying that, for how much research have you done to want to actually, put vaccine on us? And people don't want to be controlled. It's not just religious leader. Also, some people libertarians who felt that, what's the problem? Don't give your vaccines to me. And then going forward, we saw clearly in Tuskegee, in Alabama, the experiment and racism that went into some treatment. You know, I mean, of course, you remember then that quite a number of black people were left with syphilis and were not treated. And of course, the effect came and the issue came up, it became a big problem. And then we also remember, you know, there was this gynecologist, Marion Sims, then in USA, who of course had issues with like treating gynecologists, treating women, you know, anyhow, especially the black women. And people felt that this governments anyhow don't really love us. And then the conflict of science and religion has always been there. Everybody looking at the world from the prism of their own windows, trying to figure out this how the world should be. So vaccine hesitancy will be there. It will still continue. So that the key issue is this: are we building trust? Are we having right dialogue to ensure that people take up vaccines? That is the key issue. So now, I'm not surprised that people, despite all the advances we have seen in vaccination, people are still talking. With vaccine, we're able to eradicate smallpox. Of course, you could even read that pest in animals. Eradicated, 1980 we eradicated smallpox. And had killed more than up to 500 million people in the world before its eradication. With vaccines, we're dealing with polio. Of course, there was backlashes because of the issue of using it to introduce HIV, using it to do this and that, and a lot of conspiracy theory around it.
All right.
With vaccines, you know, we're dealing with measles, mumps, and rubella, and guinea worm. You know, that one is not with vaccines. That was some public health intervention. So we've seen quite a number of diseases that we're confronting with vaccine. And of course, recently you remember, with that vaccine, how could we have, you know, really cope with COVID-19 that went on around the world? And for us, preventing disease, you know, vaccination actually prevent diseases that can disrupt, you know, economies. COVID vaccine is a good example. And the challenge for us is that it's within our power, the power of every one of us, human being, man, doctors, all of us, to eradicate infection from the earth. So the bold steps, we have at least about 7 diseases that targeted for eradication, that we don't want them on earth. And that cannot be in conflict with anybody. And I'm sure religious leaders themselves also don't want diseases on earth. All the libertarians don't want diseases on earth. Everybody, no matter your thinking, you don't want diseases on earth. But the question is that, what are the bold steps you are taking? And for us, in medicine and using vaccination, we highlighted the bold steps to eradicate diseases from the air. Because the air itself is a complex interaction.
Okay, Doctor. Dr. Mebawondu, we'll come back to that. I'm going to play a clip and then you give me your thoughts on it. But for those of you who've been calling, don't worry. When we come back, we'll just throw the lines open so you can, bring your thoughts to this conversation. Probably ask the doctor a question or two. Stay with us. Still Health Hours on the Morning Crossfire.
Are you a self-employed artisan, accountant, lawyer, mechanic, tailor, market man or woman? Are you worried about the poverty that is associated with old age? Then worry no more. We have good news for you, and it is called the Micro Pension Scheme. The Micro Pension Scheme is part of the Pension 5-year strategic plan to increase the contributory pension scheme to 20 million contributors by 2019 and has 3 key benefits. 1, as a contributor, you would have access to regular stream of retirement income at old age. Plus, you would enjoy various incentives offered by your pension fund administrators. 2, you would be well informed financially, have financial freedom, and your wealth will be transferred to your loved ones in the event of death. 3, the scheme will promote growth and development of capital, mortgage, and insurance market, which will positively affect the national economy. Think micro pension scheme. Think premium pension. Premium pension, your assurance for retirement.
You won't get drink to boost your health. Oh yes. Now Wellman drink. Wellman drink.
Are you ready to feel alive and strong? Look no further, because Wellman Drink from Vitabiotics UK has got you covered. Packed with vitamins and minerals, it is a healthy choice you won't regret. Make a healthy choice today with a very low-calorie drink that is free from caffeine, preservatives, and artificial color. Wellman Drink, the ultimate choice for men. Available in leading pharmacies and supermarkets.
Who says you can't have it all with one play?
I got that defined boy. You have just won yourself.
Congratulations.
Hello, good morning.
Yes, Mellitus. One player, don't talk to 2 players because you won 20K.
So now you won yourself 20,000 naira. My name is Well Done. Okay, well done. I want to tell you, well done. You won yourself 20,000 naira.
With 500 naira, you can play to win big from 120,000 naira to 190,000 naira daily on Nigeria Info. Go to oneplay.ng and play with 500 naira. And in a few seconds, your ticket is in the draw. Or dial *347 *880 *3 hash. Win daily on Nigeria Info. 50,000 naira on Morning Crossfire. 60,000 naira on WhatsApp Lagos. 20,000 naira on Sunnyside. And 60,000 naira on Game On. So Lagos, what are you waiting for? The more you play, the better your chances of winning. Remember to dial *347 *880 *3 hash. Play responsibly. Not suitable for persons under the age of 18.
5 Alive Poppy. So much pop. So many ways to pop it. He gulps it. She chews it. He slurps it. Filled with pulp in every bowl, everyone pops it their way. So, how do you pop it?
Everyone sees the glamour, the awards, and the results, but not many see the pain associated with student journey. Long hours of film on set, long trips to multiple locations, and the vigorous times of ecstatic performances on screen all come with a lot of bodily pain. Yes, it is human to feel pain, but because we do this for the fans, we must find a way to ease these pains fast, every time. This is what it takes to be at the top. Finding an effective painkiller to ease the pain. I ease the pain with Isidol from May and Baker.
Ease the pain with Isidol for fast relief from pains and fever. Isidol comes in easy-to-swallow tablets for adults and suspension for children. Isidol, ease the pain. If symptoms persist after 2 days, please see your doctor.
Isidol, a product of May and Baker PLC.
99.3 Nigeria Info, your number one station for talk. Let's talk. This is Morning Crossfire on 99.3 Nigeria Info.
All right, welcome back. It's still the Morning Crossfire right here on 99.3 Nigerian. For our guest still with us this morning, Dr. Tuyi Mebawondu. He's a public health practitioner. Of course, he's a medical doctor. So when you hear me saying doctor, that's it. He's not a PhD. He's a core, direct and real medical doctor, not the other one. He's a public health physician. He's been, very kind to give us his time over the past few years, and we're always grateful to have him right here in the studio. But this time, because of the traffic, he was coming to the studio, and unfortunately, he met the road construction there at Falomo and had to go back to his office. We're grateful for his time. We're talking about the new malaria vaccine being rolled out in different parts of Africa. He's given us a background, and we also talked a bit about that before he joined. And he said that, yes, indeed, this is a way to eradicate malaria, which has been killing a lot of people in Africa. Dr. Mebawondu, you also talked about the vaccine hesitancy, but you raised the point that we need to embrace vaccines because that is how we were able to defeat COVID-19 and all that. But we've had some issues recently with the COVID vaccine. Some information filtering in about one or two issues that may have popped up. And people who took those vaccines are wondering if they are safe. So what do you say to that argument, that even the COVID vaccines have had some issues recently?
Yeah, there's no doubt that when you are rolling out something, even if you are drinking water, if 5 billion people drink certain type of water, you're going to have some issues with a few people. You know that the total COVID infection worldwide was in excess of 3 billion people, and then the vaccines was administered to that large number of people, quite a large number of people, and we had 6 billion actually, and we had, the vaccine administered to such a large number of people, and lo and behold, we've seen few challenges because of the differences in human constitution. In fact, when smallpox was pushed forward in the early 18th century, the same thing applied, late 18th century and early 19th century, the same thing applied. Some people have some reaction based on it. But at the end of the day, we were able to save life. With the COVID, we were able to halt the pandemic and resume normal life. So even ordinary paracetamol, when you take, you might experience different reaction from different people. It doesn't then say that the paracetamol is not functioning or not working. It doesn't then mean that the COVID vaccine is not good, because it has been a well, pushed out public intervention policy or weapon that help us to combat the disease.
Yeah, but doctor, some will argue that the COVID vaccines were rushed, because of what was going on, and someone asking, okay, where did COVID go? We're all gathering and at different points all over the world, people are gathering. And where did COVID all of a sudden just disappear into thin air?
Okay. Then you need to understand how microorganisms behave. Of course, when they come and they multiply, because like I mentioned earlier, it's a war of survival. Either human being or microorganisms or any living thing, we are interacting in the space. Okay. When they have their advantages, they multiply and try to pass on themselves from one person to another, either using animal or human being or any medium at all. Okay. And when you break that kind of thing, they go away. It's as simple as that. They go away. Some of them or other organisms then mutate and then interact with human being again. So people cannot be asking, where are those organisms? It's just like asking, where is my great grandfather? So in reality, organisms do come, interact with us and go away. But while they are interacting with us, we have to find a way to curtail them, killing us. And this is not just a new thing, it's biblical, it's religious, because even those days, the Mosaic law, both canonical and health laws, clearly telling you about isolation, clearly telling you that you have to separate people, quarantine, isolation. And then even for human being to deal with that pest, they have to be slaughtering the animals.
So someone want to ask, there are several people in this part of the world who didn't take the COVID-19 vaccines. And they're still alive, they're breathing, walking around healthy, nothing happened to them. Why?
Why should that? There's so many people also who won't take medicine, who won't take anything at all, who are still alive. It boils down to individual constitution in their body. We have been asking the question, why is it that COVID-19 was not that severe in this part of the world? We have been asking the question, okay? It doesn't then mean that COVID-19 is not severe in other parts of the world. It's just like asking the question, why do we have more of prostate cancer in black men? Okay? So there are diseases that sometimes region-specific, race-specific, age-specific. So you cannot then come and apply the rule that happens in America or that happens in Nigeria to America or vice versa. So why are people not, those people that are not having this thing? It's a question that science will answer. Science will not assume. Okay, and in due time the thing will come. Is it because we're having such a lot of infectious diseases, recurrent epidemics here and there, higher number of recurrent epidemics that have tailor our immune system to cope with the virus? Or is it because we have some constitution that help us to cope with the virus? Time will tell. But if anybody is telling you a story that because they didn't take, that's why they didn't die, I know quite a number of people that didn't take and die. And I know quite a number of people that took and are still alive.
All right.
Okay, I am also an example. I took all the vaccines, I'm here.
All right.
I don't think I'm
okay.
reality.
So we're still talking about malaria vaccine. It was a Nigerian, clergyman, Pastor Chris Yakilome of Love World, aka Christ and Mercy, who was pointing out that the black man didn't have any issue with malaria until the white man came. And when the white man came, to colonize Africa, they were the ones that were dying from malaria. It wasn't the black man. And therefore, we don't have an issue. I think we'll just take an excerpt or two of Pastor Chris's sermon. Doctor, and I'll come back to you in a jiffy after that. All
right. And when the Europeans came to Africa, they were killed by mosquitoes that didn't kill the Africans that were there. So malaria was never a problem to those in Africa until the visitors came and told them malaria was their problem. So Bill Gates announces 168 million to develop next generation malaria vaccine. For people that don't have a problem with it. So they say that malaria is the biggest killer in Africa. How do they get the numbers? How do they get the numbers? The hospitals don't even have the data. How do they get the numbers? How did they know? Those are the numbers they give them at the UN. They're not true. The nation.
Hi, my name is.
All right, Doc, you heard that from the man himself, Pastor Chris Kilome. Yes, just want to quickly take your thoughts on of that. He's made some points that sound pretty convincing, you know.
Like what? Which one is convincing?
I don't know. I don't know.
Kofi, let me tell you, it's so concerning. A statement like this is so concerning because I respect Pastor Chris. He has quite a lot of congregation and a lot of influence across Africa. And then when you see somebody who has virtually zero knowledge of how science thinks and works, okay, and then using his pulpit, his influence to actually further decimate and put our people into trouble, it's so concerning. I think Pastor Chris needs a proper education on how science thinks and how science works. If he says, how do we get our number of malaria, you should just go to the children's hospital. Just go to the maternity ward. Just understand how doctors collect, epidemiologists collect their data. In part of my work in the public service, I had worked in one of the children's hospitals for 10 years in this Lagos. We knew what we saw, we knew what we had. We could then go ahead and look at and ask the question, why are we having more child survivor this time around? Okay, it's so concerning. I feel really worried that at that level, Pastor Chris will be pushing narratives that are actually contentious. And the other thing is that, I've mentioned one of the few challenges that we're having in terms of influence of what trust in terms of government and influence of social media. Social media, religious people, and then this hesitancy family, those anti-vaxxers, they're really big issues. The greatest threat that will come to health will not be in terms of non-availability of drugs, but in terms of negative influences and narrations, weaponization of information. And weaponization of information going on. So I expect Pastor Chris to have dropped these things, and government needs to engage more people to actually push the right narratives, or else what has been our gain may be lost. Because at the end of the day, human beings, we are all interacting together. And if somebody is taking vaccine and another one is not taking the vaccine, and say an infectious disease, we'll go back to zero. So Pastor Chris does not have basis, that if he's talking about what has vaccine done, for us, we've eradicated smallpox, that's sure. We've reduced polio. We've cut down tuberculosis. We've cut down measles. All these things were made possible because we had vaccines. If you run any other hospital that does not use vaccines, you should tell us. Then the second thing is that tell us the alternative. What is it going to be like prayer of fasting that we're going to eradicate malaria and treat and do all those things? What is this that we're saying? I think honestly, the man is proper education. And I have observed that the people that actually push contradictory narratives about health, especially, and they're not doctors, it's not about the level of education, because there's what they call health literacy. Health literacy is not the same thing as general literacy. If you don't know, you don't know. You should actually ask people how science thinks. And that brings me to the discussion about the conflict between science and religion. But they should not actually, acting contradictory. It's not a contestation. It's actually collaboration that will help both sides. And religion. And we've seen that the greatest number of scientists are quite religious people. We've seen even the Vatican, for them, erecting observatory to look and validate some of those things that science say. Some of them are scientists, but I don't think people should allow Pastor Chris to go on with kind of narrative. It's damaging the health of the people. Right. Seriously.
All right. I have some questions to ask you on that, but I want to throw the lines open because I haven't picked the call yet. 0201 465 90 0201 465 7190 0700 93993 0700 993 I do know that at times like this, when issues like this are brought up, sometimes maybe people who are members of the church may find offense, but please do not find offense in our conversation, because it's a conversation that needs to be had. It's a public issue, 99.3, good morning. What's your call there? Okay, if you are ready and anticipating the vaccine arriving in Nigeria for malaria, you let us know, or if you're not, you still let us know. 99.3, good morning.
Good morning.
You're welcome. Your name and the contribution, please.
Rotimi from Ikoyi.
All right, please go.
Yeah, my contribution is that yes, malaria fever is a terrible thing in Nigeria, but I think in this part, this I think we still have more, fever that are so even more dangerous than malaria fever, like the jaundice, like the yellow fever. This one too, we have babies who have these things. So why are we not eradicating the ones that are more dangerous? Why is it malaria fever? Because malaria fever for me is very easy to deal with here in Nigeria, or if not in Africa. I know it very well that malaria fever is easier to deal with, to cure, than this jaundice.
So you're asking why the WHO is focusing on malaria and not jaundice and yellow fever?
Yes, exactly.
All right. Exactly. Thank you very much.
I had Mr. Rotimi from VI. Let me tell you. Let me repeat what I said. Malaria kills one child under 5. One every hour. One dies every hour. Okay, so malaria is so destructive to children under 5 years and pregnant women. If you're an adult, okay, you must have gathered some level of immunity over time, and then you can then be able to deal with malaria and all its concerns. But as on the 5 malaria cases, we have data, okay? Now, most of those other things you are mentioning, there are clear criteria for, because what you focus on is diseases that are killing most of your people. That is the focus. You focus on diseases that are killing most of your people. We have the figures, okay? It's good to have public knowledge, but let me tell you, public knowledge is not science knowledge. We have the figures, we can interrogate this. And for us, that's why for me now, my major function is actually, push health literacy. Because when people understand deeply why we're doing what we're doing, a lot of things becomes easier.
Okay, so you have your data and you stand by it. We have an ex-listener, 99.3. Good morning. Hello. Okay, so the doctor said malaria is equally important because it kills more people, 1 in 5 children. 99.3. Good morning.
Hello, Kofi. Good morning.
Welcome. Name and contribution, please.
My name is Olumuyiwa, calling from Aija.
All right.
Malaria is part of us in Nigeria, and we have millions of ways to cure. If malaria is in my body, I don't know what I'm using to cure it. And in conclusion, this might take in conclusion, the government that are increasing our burden can never be trusted with our health. Good morning.
All right, but this is from WHO, not from federal government. Okay. 99.3, good morning.
Yeah. Good morning, Kofi.
Welcome. Are you ready for the vaccine?
No, I'm not ready for the vaccine. I'm not ready.
Why?
Because, you know why?
Tell me.
I'm in my 30s now. When I was growing up, this malaria that's killing today, we're not killing us like the way it's killing us today. Our mother, our parents, they use our local made medicine to cure malaria then, but today they have been discouraged. They are not being encouraged anymore to be taking our local made medicine to treat
So
malaria.
If there's a vaccine that you can give to a child and that child will never have malaria in their life again, you won't give it to them?
For me, I see it like conspiracy. to, like people have been saying.
Conspiracy to do what? To do what? Let me find out. To do what?
See, like 5 years ago, if I can't say what I'm saying today, now, but, now I'm saying it because of what I'm seeing from the Western world to Africa. These people...
So conspiracy to do what?
See, Kofi, you know what you want to hear it from me. But
okay, all right. You're not ready to spill the beans. Doctor, I hope you're still there. We have Pastor Ladi on the line. Pastor Ladi, yeah, where are you calling from? Yes, I'll come to you.
Can you hear me?
Oh, Pastor Ladi, your line isn't too clear. Please call back. Sorry. 99.3. Good morning.
Hey, good morning. How are you?
Very well, thank you. Your name and contribution, please.
My name is Haruna Rashid, actually. I want to find out or make my comment, actually, in respect of this vaccine.
Yeah.
Which you all know that there are several times or several ones that happens, some in Libya, some even in Nigeria, here in Kano. How do you know that this vaccine is not cheating? It's not going to be cheated. It's not going to affect our children, which they left them with nothing. Look at them. We have them all over in Kano, at least. Is this kind of vaccine that they just come and said is going to be against our follow and the rest of it?
When you say you have them all over Kano, what is the them you are talking about, please?
Some years back, is by this company, one of these foreign companies. They came and tested some of this vaccine. They say it's vaccine that time. And as a result, there is a body somewhere, some years back. It's not long ago. That is when they said they will come and build some schools for them, things like that. Because they accepted they were at fault. So why are they bringing this vaccine? How do you know that this vaccine is working? How do you know that this vaccine is good?
All right. Thank you. Thank you very much. Doc, I'll come to you shortly. Please hold your horses. I'll come to you shortly. 99.3, good morning.
Good morning, Mr. Kofi.
Welcome. Your name and contribution, please.
I said Princess.
All right. Welcome.
Yeah. In follow to the last caller before Pastor Ladi was called, I think what he was trying to say, and I agree with him, that the conspiracy to actually depopulate Africans, because we've seen and heard even scientists that partook in all these experiments. Even in America, they use the black population as guinea pigs, and how they will now bring it to black Africa. The only thing that can satisfy the African man is that the vaccines that are generated, that are researched and generated in our continent. That is what we will take. Like the Chinese, they have drugs that for their peculiar diseases. We African scientists, African doctors, African people that are in the science world should not depend on what the white people are telling them or what the Westerners are telling them. They should be proactive enough to generate their own type of vaccine, their own medicine, homemade. You understand? So that then we can start having trust in our medication and not fall victim to experiments by the Western world. Thank you very much.
All right, thank you very much for your time. Doc, I think I'll bring you in at this point. We've had a lot. From conspiracy theory to and all that. Doc, over to you.
Yeah, indeed. Conspiracy theory will not go away. Vaccine resistance will not go away, but it should be reduced. Medicine has gone far from what is being practiced in the 17th, 18th, and 19th century. Medicine has sharpened the method of investigations, of checking of what is possible and not possible. Because of this progression, we've been able to eradicate polio substantially. Smallpox is gone substantially. We're not seeing measles killing people substantially. Tuberculosis has been reduced significantly. So we can count the gains of the vaccine preventable diseases that saves in the past 10 years have saved more than 50 million lives. Okay? That's a really significant thing. Now, when the one is connected, there's a clear case of how to aggregate data and understand what is going on. I have a big concern because people just think that health is localized. No, health is not localized. we pass knowledge and information across the world, and that's why it's possible for me to carry my bag and go to America and practice or Russia and practice, because the standard of how practice is practice and reasoning is clear to everybody. Now, the question is that if people now say that, okay, they don't want to take vaccines, is it holy water they are going to take? Let's ask that. I've had friends, that had paralyzed because their mother refused those vaccines. I have those ones that had brain damage because they are, they got their mother refused those vaccines. I have families that, living in the villages, and you're seeing them having the worst form of tuberculosis because somebody's fell. Their own was actually a point of ignorance. But how do you now define educated people that cannot sit down and deepen reasoning? It's so concerning, because that may speak to the depth of why we are the way we are. You understand? Yes, we are not the only one with religion. And when people say that they want to reduce African population, I ask them, they should go and do a data in the past 50 years, whose population is growing faster. Nigeria's population is about, for every woman, 5 children. That's the data. That's a lot. And we're projected to reach one population as much as 400 million in the next 10 years. So are we really reducing population in reality compared to Italy, compared to the other countries, So when they say that they want to reduce African population, I just laugh. For what purpose? People know that they should know that there are ethics. Of course, in some of these vaccines, you could have challenges, like the experience the one that was done with a meningitis vaccine, that had to be withdrawn. It's not only that, thalidomide killed a lot of people in America and Europe, So why try to test drugs? So because after that, they have to up the standard of drug testing. But that does not take away the fact that if we are to get over a lot of things in the world, some cancers, some killing infections, some deadly infections, killing people, we have to deploy vaccines. Nature itself is about vaccination. Isolation, quarantine, prescribed in the Mosaic Law is actually have to deal with diseases. Jesus even said that I bear your disease, I've taken away your infirmities. That is vaccine. That's the kind of vaccine. We're talking about paradise now. The concept of paradise is a place where there's no disease, where there's no lack, where there's no shortcomings at all. So now, if you have the concept of paradise, is it possible to have that kind of thing on earth where we not have? If we can have it, what means? That people just challenge us and tell us the means which they want to do, instead of posturing and thinking that they want to kill them, they want to remove them. For what now?
All right.
What purpose?
Dr. Tuyi Mebawondu, we have to leave it at that. I want to thank you so very kindly for your time. We should have this conversation again, but we have to leave it at that. I want to thank you, sir, for your time this morning.
I'll give myself sufficient time to come to the studio.
Please, we'll have this.
Conversation is very free when you are in the studio.
Yes.
It's not.
We'll have this debate. Thank you, sir. Tuyi Mebawondu, public health physician. He's joined us via video link. We'll take a break. When we come back, we'll mop up and round up the show. Stay with us.
Mommy, my teacher said 90% of my brain will develop by the time I am 5.
Really? What else did she say?
She said I need
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.